Hi, welcome back to part 3 of your BackFit Toolkit. In this video, we are going to talk about the progress tracker. This enables you to track your progress with much better degree of accuracy. The most common misconception in back rehab is that pain is the only indicator letting you know how much progress you have made. This is wrong. Pain reduction is our ultimate goal, but pain itself isn't always a good indicator of progress. In the case of someone with a very weak lower back, pain can often be the last thing to improve. It can be highly demoralizing when you've been putting so much effort into your improvement, yet your pain stubbornly remains. This progress tracker has been taken from a scientifically validated assessment called the Rowland-Morris Disability Score. Practitioners and researchers in orthopedic and neurological medicine often use this tool to assess functionability of the back pain sufferers, meaning how much day-to-day stress and strains are required to aggravate your back. If this score comes down, we can say with a degree of confidence that the effects of your back pain are improving. We simply don't want to stop short of the goal of pain relief when it's just around the corner. When bodily tissue has been inflaming for a long time, inflammation, therefore pain, just doesn't stop straight away. It can take weeks. The progress tracker means that you can get a more accurate picture of how far along you are by seeing the improvements in your day-to-day activities, meaning that you don't stop short of that goal of pain relief. You then gain motivation to continue just one more day, one more week, one more month if necessary, but having that knowledge you are going in the right direction. Pain relief is our number one target, and better functionability is how we achieve it. You will require 2 coloured pens. We suggest black and another colour. We are using black and blue. In the week 1 column, using the black pen, answer yes by putting a tick in the box. If no, leave blank. The amount of yeses gives you a score out of 21. After a week, tick the boxes in the week 2 column in the same way. However, if the answer is still yes, but you feel there has been some improvement, tick this in a different coloured pen. Continue doing this in the same way to week 6. You are wanting your Rowland-Morris Disability Score to come down in total, or an increase in coloured ticks. This tells you there is progress in your back problem. So we have gauged this level of severity and irritability of your back pain. We have taught you how best to strengthen. Without proper alignment, you don't fully maximize the benefit of this program. The website you are on shows you how to gain complete control of your alignment. What next? It is now time to directly treat the symptoms that misalignment, weakness and inflammation have been causing on your body. Please look out for the next email where we will teach you some really good massage techniques that you can safely and effectively do at home. Freeing up adhesions and muscle tightness is an essential part of your rehab. Until next time, gain knowledge, gain control. See you soon.